The National Institute for Communicable Diseases is warning of a huge surge in flu cases with clusters detected in schools and places of work. The public has been urged to get vaccinated in order to be better protected this winter. Let's talk about the situation with epidemiologist Dr. Joe Barnes. Dr. Barnes, a very good evening to you. I'm grateful for your time as always. Is this unusual for this time of year?
Good evening to you and to our viewers. This is the normal flu season starts usually at the beginning of winter or just before that. There has been influenza activity reported since early in May, which is slightly earlier than usual. But I wanted to point out to you that we are just coming out of a very unusual situation, and that is the COVID-19 years. So we can expect things to be not quite as the same as we are used to.
And let's talk about the COVID period then, because during COVID, most of us had to be apart from other people. We were all either working from home, doing everything, in fact, from home, and you were around maybe, let's say, 2, 3, 4 people regularly. We also, when you ventured out, were wearing masks. I wonder what that has had as far as an impact on our ability to be resistant to strains of influenza and then fight it better.
There have been a number of scientific publications, journal articles to show that there has been a very definite, significant reduction in flu, quite a large reduction in flu, both in serious hospitalized cases and in people who died from it. And that, by the way, happens every year. It has been a huge reduction, not only during the time that people stayed at home, but also wearing masks and washing your hands frequently and sanitizing surfaces where you work. So that helped an enormous lot, because the influenza virus carries over to other people in exactly the same way that COVID-19 does, through infected aerosol droplets when people sneeze or cough or talk, and through touch that people with infected or contaminated hands had touched. So the fact that we were so diligent in the COVID period helped bring flu down. But unfortunately, there is always a price to pay for a bit more freedom, and we are now coming into contact with many more people, and the old enemy influenza viruses have been jumping far more this year than in the past, and it seems as if by the reports that I have heard informally and talked to people, as if it had hit people a little bit harder this year than in the past.
Who then is most at risk?
As always, and I count myself in there as well, as always, the elderly, however you define that, but normally people over 60, and particularly also for sensitive to getting very, very sick may also be the children under 2 years old. But anybody with a compromised immune system, people who have or have had TB, or who is HIV positive, or suffers from asthma or diabetes or any of those other health burdens, they are particularly sensitive, and they should definitely get vaccinated against flu.
And there'll also be people who will say at this time of the year they get the regular cough. How do you know when it's more than just the regular cough? Do you feel it instantly, or should we just go to the doctor anyway as a precaution?
Going to take the vaccine is always a good call, whether you get a cough, and I'm not quite sure what they mean by it, because it could be the common cold, it could be some kind of allergy that's in their environment at this time of the year. And if they are unsure, it is always wiser to consult a health center or a medical trained person. But I would still encourage them, cough or not, to get vaccinated, because if they're carrying a cough this time of the year, every year, it means that they are sensitive to something around it, or that they frequently get infections. So that doesn't preclude them from getting the best protection that they can. It's not 100%, but it's much better.
Mm-hmm.
But I greatly fear, I have to tell you, that the COVID-19 pandemic has caused such a lot of false information and vaccine hesitancy and anti-vax movements that I'm really concerned that people who should be protected against serious flu may not get that protection.
I wonder if there aren't, shall we say, the weapons of war from COVID-19 that we could perhaps employ now. I'm thinking, for example, of distancing, the wearing of masks where possible. Should we, I know it's not going to be government sanctioned at this level, but is that something that we should even consider for our own health?
Indeed, if you are at risk, why put your life on the line because you are too embarrassed to wear a mask? Wear a mask for the time that you feel that you are sensitive to the infection, or also, particularly, I appeal to people who already have the flu. Just during this time that you feel ill and that you are coughing and spluttering and so on, wear a mask. Even if people look strangely at you, you will really help everybody in your environment, and you will help yourself. Don't feel embarrassed to do that. It really works. And wash your hands frequently, particularly when you've been outside to the shops and other places like that. When you come back home, just wash your hands and discard your mask. It would really protect those vulnerable people amongst us. And there seems to be, to me, to be no sense in running the risk of getting very, very ill because you were too shy to protect yourself.
Dr. Jo Bounds, good to speak to you. Thank you for your time as always.